Let's discuss the anterior compartment of leg. So are the various structures that are present in the anterior compartment of leg? The muscles are the tibialis anterior, extensor hallucis longus, extensor digitorum longus, and the peroneus tertius. These are the four muscles comprising the anterior compartment of leg. The blood supply is via the anterior tibial artery, which is a branch of popliteal artery, and the nerve supply is through the deep peroneal nerve. These are the four muscles of the anterior compartment: the tibialis anterior in green, the extensor digitorum longus in red, the extensor hallucis longus in purple, and the peroneus tertius here in peach. Now we are going to do these one by one. Tibialis anterior is the anteriormost muscle of the anterior compartment of leg. It arises from the lateral condyle of tibia and along with that from the shaft of tibia, and it is inserted into the medial cuneiform and base of first metatarsal. The extensor digitorum longus arises from, this one is the extensor digitorum longus. It arises from the lateral condyle of the tibia, along with that from the upper part of the medial surface of fibula shaft, and it is inserted on the distal phalanges of the lateral four toes. Then is extensor hallucis longus. The extensor hallucis longus, this one here, arises from the middle part of the shaft of fibula, and it is inserted on the base of the distal phalanx of the big toe. Then is peroneus tertius or fibularis tertius. This muscle arises from the lower part of the shaft of fibula, and it gets inserted into the base of the fifth metatarsal. This picture summarizes the origin and insertion of these muscles. All these muscles of the anterior compartment of leg are supplied by the deep peroneal nerve or the deep fibular nerve, and the action of this group of muscles of anterior leg is dorsiflexion. In this picture again, we can see the muscles of the anterior compartment: the tibialis anterior, the extensor digitorum longus. Then this one is the superior extensor retinaculum, and this Y-shaped is the inferior extensor retinaculum. Retinacula are structures under which the compartment of that area passes. So the extensor retinacula are two: the superior and inferior extensor retinacula. The superior extensor retinaculum is attached to the anterior surface of shaft of tibia medially and to the anterior surface border of shaft of fibula laterally. And the inferior extensor retinaculum is Y-shaped, having a stem and the two limbs. The stem is attached to the calcaneum, and the two limbs, upper limb is attached to the medial malleolus of tibia, and the lower limb is attached to the plantar epineurosis. And all the structures of the anterior compartment, the four muscles and the deep fibular nerve plus the anterior tibial artery, all these pass beneath the two extensor retinacula. The neurovascular supply of the anterior leg is via the tibial artery and the deep fibular nerve. The anterior tibial artery is the terminal branch of the popliteal artery. Here you can see this is the anterior tibial artery. It starts from at the level opposite the popliteal fossa, tibial tuberosity. It enters the anterior compartment of leg, passes from the upper opening of the interosseous membrane here. Then it goes down on the anterior compartment of leg, and then at the level of the two malleoli, the medial malleolus and the lateral malleolus, it becomes the dorsalis pedis artery. In this picture we can see better. This is the anterior tibial artery, enters the anterior compartment through the interosseous membrane opening, and then it goes down first between the tibialis anterior muscle and the extensor digitorum longus, then between the anterior tibialis anterior and the extensor hallucis longus, and finally between the extensor digitorum longus and extensor hallucis longus. This arrangement is because the extensor hallucis longus crosses anterior tibial artery from the lateral to the medial side. This artery gives muscular branches to the muscles of the anterior compartment plus the anastomostic branches, which are the anterior and posterior tibial recurrent arteries. It also gives the anterior medial malleolar and the anterior lateral malleolar branches. The nerve supply of the anterior facial compartment is deep peroneal nerve. The deep peroneal nerve is one of the terminal branches of the common peroneal nerve. The common peroneal nerve is coming from the sciatic nerve. So the sciatic nerve in the back of thigh gives common peroneal and the tibial nerve. The tibial nerve at the level of the neck of fibula divides into a superficial peroneal and a deep peroneal nerve. The deep peroneal nerve we are going to discuss here because it is the nerve of anterior compartment of leg. The deep peroneal nerve enters the first passes through the substance of the peroneus longus muscle, then it goes down and supplies the muscles of the anterior compartment. Then at the level of dorsum it divides into medial and lateral branches. The branches are the to the muscles of the anterior compartment plus the extensor digitorum brevis. Articular branches are to the ankle joint, tarsometastarsal joints, and the metatarsophalangeal joints. And the cutaneous branches are to the adjacent sides of the first and second toe. So this is all about anterior compartment of leg.